Hello, I wanted to make this video to discuss healthcare in the Philippines because I feel like there is a lot of content on YouTube about being in the Philippines, about, cost of living, but I wanted to make a video where I specifically talk about healthcare because that's a big thing. A lot of people in the US or in Europe or in other countries, they already have healthcare and they're thinking about moving to the Philippines. And so a big question is, what about my health? What about my doctor? What about my medicine? What am I going to do there? It's a foreign country. How do I go to the doctor? How does it work? So in this video, I want to tell you my experiences with healthcare here in the Philippines and the pros and the cons and how it's very different, at least from the system in the United States. So we all know that in the US, healthcare is very expensive. It's a big problem. Even if you have a job, you still oftentimes have to pay quite a bit of money for healthcare. It is significant. As a concrete example, I knew a guy who had a wife and two kids, and he had a great job, and he still had to pay over $1,000 a month for healthcare for his family. And that was like 20% of his paycheck or more. So very, very hard in the US, very expensive, really, really tough. It's a huge part of your income in the US. So here in the Philippines, if you want to go to see a doctor, and I'm gonna do a little conversion here, pesos to dollars, it's typically gonna cost you, and this is from my experience, I got a cold and stuff, I've been to the doctor, about $12.30, about $12 usually to go to the doctor, maybe 20 max, it's not gonna be that much. And then if you get a prescription, it's probably going to cost you about the same or less. So 20, $30, you go to the doctor, you get some antibiotics, you're done, right? Whereas in the US, if you go to like an urgent care, it's going to cost you $150 or more, sometimes 250. I remember one time I had an ear infection and I went to the urgent care and they couldn't tell me how much it cost. And I was really upset. And I got the bill in the mail and it was $253 plus my antibiotics. So it's very expensive in the US. Here we're talking less than $30 and that's the high end, okay? Again, we said $12 for the visit. So less than $30, you're in the doctor, you're out, it's done. As far as more serious things and more serious medications, so the medicine here is also cheaper. So if you're taking any type of like medication for like I don't know, high blood pressure, cholesterol, if you're on some type of medication, you're going to find that yes, it is cheaper. It's not like dirt cheap, but it is significantly cheaper than the cost in the U.S. So you're going to save a lot, probably like 50%, maybe more. Okay, in general, these are just general numbers, right? You're going to have to look for your specific medicine in a pharmacy here in the Philippines to check the prices. But we're talking about 50% less than what you would pay for those medicines in the US, typically, from what I've found from the medicines I've looked at. As far as procedures, so like if you're going to get like, an MRI, a CAT scan, you're going to get blood work done. You get tested for your cholesterol or high blood pressure, or just getting some blood work done, or something more serious. Again, you're looking at a huge reduction in prices. It's you can't even compare. Childbirth, again, another thing. You're looking at like a quarter of the price here. So if you have kids here, it's just so much cheaper. Everything is cheaper here. Okay, so do you need health insurance? Well, my answer is I don't know. I haven't really done any research on health insurance in the Philippines because I feel like I don't need to because the cost is so low. The cost of healthcare in the Philippines is astronomically lower than the cost of healthcare in the US, even with health insurance. So it's that much cheaper. So if health insurance is something you're concerned about, the cost, worry not. Now, as far as access to healthcare, it's wildly different here. I know in the US, I had a doctor that, I would call and they would never pick up the phone. And I would have to call several times. They'd finally pick up the phone. I'd make an appointment, and it would take 2 to 3 weeks or a month sometimes. Also in the US, if you want to see a doctor, sometimes they're not even taking new patients. You call and you finally get through, and it's just a hassle. So not only are you paying crazy, premiums on your insurance, like the story of the guy who was paying $1,000 a month, you're not able to even access the healthcare. And when you do, it's still expensive. So it's just a botched system. There's no way to rationalize it. It sucks. It plain sucks. There's no way there's no way to say it's good, other than maybe the care you get is very good, right? They say the healthcare in the US is good. You get good quality care. Here in the Philippines, it's different. So if you have a cell phone, sometimes it's difficult to make phone calls because you're calling a landline. So you have to have a landline to call a landline sometimes. So it's not super straightforward. So what you do is you just go on your phone, you go on Google Maps, everything's in English, you type in what you're looking for, and you just go to a clinic, right? You just show up and you wait and they see you that day. You can just walk into a doctor's office and see the doctor, and they will talk to you, and they are very nice, and you will get help, and you will get a prescription, and they will give you what you need, and you just pay. And again, we talked about the prices, right? $12. I mean, so it's incredibly cheap, incredibly accessible. There are hospitals here. There are public and private. The private ones are the best ones. Okay. You walk in, they give you a number, you sit down, okay, and then you just fill out some stuff, and then you just pay. You can pay with a credit card, you can pay with pesos, you can just pay. You can pay for everything. You can pay for tests. If you have a procedure, you just pay for that. And these are hospitals with real doctors, they're clean, and it's fast service and it's same day service. It's not like the US where you have all these appointments and you just walk in. And I don't know why this is the case. Maybe there's more doctors here. I don't know what it is. I mean, there must be more doctors, but that's just the way it is. So you can actually access healthcare here, which is huge. So not only is it cheaper, it's very accessible. Okay, it's very accessible. Now, as far as the quality of the healthcare, the quality of the doctors, the quality of the equipment, the cleanliness of the hospital, right? You know, are the machines state of the art? That I can't speak to because I don't really have that much experience. I just know what it costs to do certain things and how to access healthcare. So, cost and access are really all I can speak about. My few experiences with doctors here, I did get sick a couple times. Um, I'm fine now. Have been very, very positive. And I actually got some like routine tests done here, and it was very inexpensive, very cheap, way cheaper than the US, right? So, that I would say is phenomenally better. I haven't had anything serious happen, thankfully, so I haven't like gone in for like a procedure. There's nothing wrong with me. I'm not sick, that I know of. So I feel fine. So it's been good for me. But you know, people get sick here all the time. They go to the hospital all the time. Babies are born here. People have surgeries. I saw a guy. I've seen foreigners at the hospitals, right? People from the U.S. in Philippine hospitals getting care, getting surgery. It's a thing people do, and it's cheaper. It's cheaper. So healthcare, I think, is you can check that off your box, in my opinion. If you're thinking about coming to the Philippines, don't worry about healthcare. It's very easy to access. You can just show up. I recommend going to private hospitals. They cost more, but you get better service. Pay with the credit card, you can pay cash. It's very easy. People are very nice. You will likely get same day service. Yes, sometimes you'll go in for a test and they'll say, oh, we can't do this test unless unless your doctor, uh, you know, prescribes the test. If your doctor requests the test, that's when you can get the scan. Then you just go see a doctor. You walk into a doctor's office, you talk to the doctor, and you get it. Telehealth, I almost forgot. So in the US, they have like Teledoc and they have other services where you can like use your phone. There's apps here. I forgot the name of the app. It's on my phone. It starts with a K. I forgot what it's called, but I've used it. And you just go on there and you can talk to a doctor in English, or you can do video chat or just chat. I feel chat is quicker. And it's like, I think it's like 500 pesos or 800 pesos, which again is like $8. It's like less than $8, right? Less than $8. And you talk to a doctor and they give you a prescription. And then you just walk to a pharmacy and get it filled right there. You don't have to wait. In the US, when you go to a pharmacy, you have to give the pharmacist your prescription and you have to wait and come back in half an hour. It's like this big ordeal. Here, you just walk in, you stand in line to give them the prescription. They just fill it and they give it to you, right? It's fast, it's easy. Um, so very easy. You can do the telehealth. That's what I did. I got a cold. Oh no, I had a sore throat, and they gave me some antibiotics, and I just used the little telehealth app, and I got some antibiotics, and it went away. I got better. I got better. So very very quick, very easy. Um, it's shockingly cheap, shockingly cheap. So healthcare, in my opinion, in the Philippines is very good. It's affordable, and they have clinics that are cheaper, right? So I'm talking about like going to actual doctors that aren't free, going to private hospitals that are more expensive than public ones, and it's still remarkably cheap. And again, the telehealth option is great. In the US, I think telehealth is like $100 usually or more, 120 per visit. Here we're talking like $8, and you get the prescription, and then you can go get it. You can go get it filled. So yeah, I think that's all I wanted to say about medical care here in the Philippines. Healthcare, it's not something you should worry about. There's other things in the Philippines that might be different that you have to adjust to, but healthcare is one that is a pro. So it's definitely a pro, and I think it's great. I hope it's been helpful. If you enjoyed this content, subscribe. I'll try to post more content like this. If you have questions, leave a comment. I'll try to answer them or make a video to respond to your questions. Take care.